Alright, hello everyone. My name is Angeline Lapita, and welcome to my presentation on the effects of cosmetic surgery on young individuals and society. Alright, so in the past recent years, Instagram, Twitter, Vine, Snapchat, all of these social media platforms have become popularized for their easy to share models that gain users a wider range of audiences. And with this, there's a constant exposure to pictures or videos that are being bolstered with likes and comments, which can create ideals of success and happiness just from likability or surface level beauty. And for some of those in the audiences, there can be an antagonistic self-perception of yourself, which can lead to dissatisfaction and wanting to change your body due to comparing yourself to unrealistic standards that are posted online. And these feelings, which you want to change about yourself, you want to have a better attitude, can possibly be achieved through a physical change, which can be done through cosmetic surgery. And 2 years ago in 2018, there were just under 227,000 cosmetic procedures done on patients aged 13 and 19. And now if we look at the data provided by the same website from the American Society of Plastic Surgeons, we see that for invasive and non-invasive surgeries, there was an increase for non-invasive starting from 2010 all the way up to 2012 and then plateaus up until 2018. Now, the opposite is true for the invasive, so we're mostly going to focus on how the increasing trend for the non-invasive can be reflected with our social media influence, which is a correlation that is also described in an article by Khalid Arab, The Influence of Social Media on the Decision to Undergo a Cosmetic Procedure, that was posted in 2019. And in addition to having an increase in procedures, we should also take account that there are many implications from these, which could be the popularity for non-invasive procedures increasing, which is included by lip fillers, Botox, nose jobs, which are the three most popular at the moment for the past 2 years. And then also the doctors that are performing these procedures are also faced with underage patients and the question of how young they should be or if a level of maturity is required before having the procedure done. Other dilemmas from having it done already would be having to find alternatives based on lack of resources or getting results that don't alter the negative attitude towards self-image, having lifelong consequences from a complication, or the change in perception from others in addition to yourself. And in a public health perspective, we can always account for educating the public of editing images so as to not idealize unrealistic body standards. And we can also provide information to prevent adolescents and younger individuals from making hasty decisions or to adequately prepare them with finding credentialed doctors and procedural knowledge so that they end up with the best quality experience they can have. And if we look at this, the main emphasis is on getting the information out on unrealistic body standards because of the social media influence and just informing the general public of the risk they run from getting the procedure at a younger age. Alright, and other potential discussion topics could lead to maybe including how the older populations are affected by social media and how their perspective on cosmetic surgery has changed, or has not changed in the past decade because they do account for a larger percentage of cosmetic procedures. And that is all for my presentation. Thank you for watching and stay safe.